Earlier this month, the American Health Care Act, the bill to repeal and replace the Affordable Care Act, was introduced, and seniors have questions about what this means for them. Norm Steiner is here with answers. Norm is the Vice President of Business Development for Medical Mutual of Ohio. So welcome back to the show. We've heard about Medicare and Medicaid and the exchanges, all these healthcare jargon things. Can you start out by just helping us know what the difference is?
That would be great. It's great to be back on the show. I think it's important to start out with Medicare, because Medicare is really set up and established for those individuals that are over the age of 65, certain people that have disabilities, as well as anyone who is diagnosed with end-stage renal disease. So that's the Medicare population. Medicaid is actually made available to individuals that are lower income, and it's a comprehensive plan design. And then lastly, the individual marketplace is designed for those people that are under age 65 who have the ability to access health insurance through either the exchange or through individual private brokers.
Okay, seniors everywhere I'm talking to are worried about the changes to the Affordable Care Act, and that's going to really affect their health insurance. Is that really the case?
You know, it's interesting, as we watch town hall news conferences or meetings that take place across the country, you see a lot of people that are really upset and concerned about what's taking place. And I think what's really important to remember is that Medicare and Medicaid actually were around before the Affordable Care Act took place. And so while the Affordable Care Act had an impact on all aspects of health care, including physicians and insurance companies, the Medicare and component is really the one that has been around intact for the longest. Medicaid and individual have had the greatest impact in that the Medicaid expansion was part of the Affordable Care Act where more people were eligible. And on the individual under 65, with the elimination of pre-existing conditions and the introduction of subsidies, made it much more available for those individuals. So the important thing to remember is that, you know, the Medicare and Medicaid programs were there. We expect for them to be there, and the laws haven't been finalized yet. That right. is still being worked on.
We got to still keep watching that.
Absolutely.
Huh? All right. So, but still, I think there's a lot of viewers who aren't on Medicare or aren't on Medicaid who are still worried that this whole change in the healthcare rules and laws are going to affect them. So there's still questions out there.
There absolutely are, and I think what's really important is that we just advise people to watch the news, to get as much information out there as possible by reading. And if there are questions, at this point, it still resides with our state representatives. And then when we do have a final determination, I assure you that Medical Mutual will be back on this show to explain how the law will have an impact on those people that live in Ohio.
All right, we will welcome you back at that time.
Wonderful, thank you.
Changes to healthcare reform can be difficult to understand, especially with everything that's been proposed this month. My thanks to Norm Steiner for this healthy dose of information about these healthcare insurance programs.
Learn more about Medical Mutual of Ohio by calling 1-844-606-5387 or visit www.medmutual.com/go.